CPMC, or the Council of the Presidents of the Medical Colleges, is the collective grouping of all the colleges, the specialist medical colleges, remembering that general practice is a specialty. And by providing ideally one voice to government. Now, a few years ago, the relationship between CPMC and governments was very poor. There's been a lot of work to rebuild that relationship, and now the current chair has a degree of direct access to Minister Butler and others. And this has been a major advance. A marker of success for CPMC would be where the chair of CPMC has in fact the same access to the minister that the president of the AMA, Australian Medical Association, has to the Federal Health Minister. For ANZCA Fellows, this means that we have a chance of having a direct voice to the Federal Health Minister, but also across the jurisdictions in Australia. I should also say that there are related bodies in New Zealand. At a time of existential crisis for medicine in both Australia and New Zealand, I think it's really important that we have greater positive interactions with government. So through CPMC, we're hoping to really build those relationships. ANZCA is one of the biggest colleges, and currently I'm on the executive, or now the board of CPMC, really helping to drive what's happening and have insights into the politics. The advantage, not only ANZCA adding to that voice, but also it empowers us to have a better understanding of the political landscape that we're working in as a college. So ANZCA is working with CPMC to try and look how we can collectively address major concerns. We are also working with a number of the multitude of committees, but I'd point to two particular interactions just recently. One is where a group of us, including members of the Queensland Regional Committee, met with the Director General of Health in Queensland, looking to expand the number of advanced training places across a number of Queensland hospitals. These discussions at times were quite robust and included the nature of our training and whether we had too much subspecialty work within our training. But the strong argument put forward was that if the government wants good generalists, that is people who can go into regional Australia and be comfortable across a range of problems, including the patient who has a head injury from a car crash or has a degree of hypotension and shock from sepsis, then we need to be familiar with dealing with a patient with raised intracranial pressure or managing a patient who requires inotropic support. For fellows who have particular concerns, yes, the ASA can help, and where the college can help most is where fellows feel that there are breaches of college professional documents. We can and we have written to hospitals, both public and private, about concerns of breaches of ANZCA documents. And I think, as I've said many times, it is these professional documents that is one of the major benefits of ANZCA for anaesthetists in Australia and New Zealand. As with every year now, on the 16th of October, we're celebrating National Anaesthesia Day. And this is where we try our continual effort to raise the public profile of anaesthesia in Australia and Aotearoa in New Zealand by having fellows engaging at all sorts of activities. This year, one of the major themes is "You're in safe hands," emphasising to patients that our fundamental roles to keep them safe during their perioperative journey. The major events for the college, our fellows and other members, is the Annual Scientific Meeting, which I think is a vital coming together of scientific thought, where people can learn how they can enhance their practice, often by either changing their practice or reinforcing what they do. But importantly, I think, and most importantly, is the networking component. In 2026, the ASM will be in Auckland, Aotearoa, New Zealand, and I think fellows will very much enjoy that interaction. For many Australians travelling to New Zealand, which is a wonderful place to go, and I can assure fellows that the organising committee are bringing a very exciting program that they'll get a lot out of.